All across Tennessee, hospitals and doctors are watching the supply of equipment designed to keep their staff safe and wondering if they'll have enough. News Channel 5 Chief Investigative Reporter Phil Williams discovered there is plenty of reason for concern.
It's a situation that experts say has left state fighting against state, county against county, and a kind of Hunger Games for protective equipment.
There are two different types of N95s. They all are they're just thicker, higher filtration, and so usually put on like this.
Dr. Tawfiq Assad is on the front lines of the COVID-19 crisis in Williamson County, the first county to record a case of the coronavirus. He says without more personal protective equipment known as PPE, the crisis could turn catastrophic.
The CDC is recommending that we consider wearing bandanas and homemade masks, and that's not standard medical care. We're doing that not because it's known to be safe or that it's thought to be equivalent. We're doing that because we're facing critical shortages, and that's not a good place to be in.
In Nashville, assessment centers like this one near Meharry are all set up around the city, ready to provide drive-through testing. But without the PPEs and other supplies, that cannot happen. Congressman Jim Cooper.
Some C-17s flew into Memphis the other night, bringing in supplies from all over the world. Yet they were distributed in a secret fashion, and we don't know whether it was an equitable fashion.
A memo from the Tennessee Department of Health tells hospitals that the state received a very limited one-time supply of PPE from the Federal Strategic National Stockpile. Those supplies will be divided among 8 regions according to the population, with each one getting about 9,000 surgical masks, 1,500 surgical gowns, 1,700 face shields, and 5,000 gloves. State Senator Steve Dickerson is also a physician.
What we're concerned about is in 2 or 3 weeks when the people who are carrying around the virus now, who have no symptoms, become symptomatic, that we see a real stretch on the healthcare system, and we see the PPEs, the protective equipment, in short supply. And so we have a couple of weeks breathing room, but that doesn't mean anybody's being complacent.
We have some of the best medical centers in America here, and we're likely to be besieged with cases from all over our region, not just within Tennessee.
Cooper says the distribution of safety equipment ought to be based on demand, not population. He also worries about the memo's warning that all PPE should be inspected and tested prior to use to ensure quality.
I wasn't expecting that. If the government sends out something, it should be quality stuff that medical professionals can rely on.
And having a shortage of protective equipment is adding stress to an already stressed out system.
But I can tell you, having worked in this in the hospital caring for these patients for the past week, everybody's on edge. Everybody's stressed out. People aren't sleeping as much. People are working longer hours, and people are nervous.
That's why the doctors say it's so important for Tennesseans to shelter in place to slow the spread of the virus. Senator Dickerson says the governor's order halting elective surgeries will also conserve badly needed supplies. Phil Williams, News Channel 5 investigates.
Thank you, Phil. The federal government has said it is up to each state to find the supplies it needs.